Welcome back to Sleep Better TV. My guest is Dr. Steve Lawson with the TMJ and Dental Sleep Center in Winnipeg. And we're continuing our discussion today on pediatric sleep disorders. Dr. Lawson, talk about how pediatric OSA, for example, often can be misdiagnosed as ADHD.
It absolutely, and you know, for the kids, it's probably the most underdiagnosed, underappreciated entity out there, and that is the fact that we tend to assume that it's only the adults that have sleep disordered breathing problems, obstructive sleep apnea, and clenching and grinding. But in fact, the numbers are astounding for children, and at younger ages, we have an opportunity to diagnose and treat more definitively with somebody young who has narrow and collapsed dental arches. We can do non-surgical expansion of the arches and develop the airways, which leads to actually a better growth potential for the relationships between the mandible and the maxilla. That's the upper and the lower jaw. Mm-hmm. But the work we can do with the kids is profound. I mean, even 4- and 5-year-olds that come into the office with obviously not even any permanent teeth yet. Sometimes we can put buildups on their primary teeth to just open the vertical. If they're overclosed, we can turn these kids from snorers and kids with very compromised situations very easily into kids with potential to breathe. And you know, the issue of breathing effectively, going through the proper sleep cycles, and healing and cognitive balance is quite astounding. And there's a pretty significant body of evidence out there now that points clearly to a significant correlation between an airway issue and ADHD in these kids. They need air and oxygen, not Ritalin. Mm-hmm.
And so in many cases you can see that a sleep-deprived child doesn't have proper cognitive ability because of the lack of sleep and the sleep depth, and that they're often just rubber-stamped with ADHD. And
oh, absolutely.
Really they just need some sort of sleep therapy.
Yeah, the incredible thing and the humbling thing is when when the mom comes back with her son or her daughter, and we've done a fairly simple maneuver to help them breathe. Mm-hmm. For the mom to come back and say, "My God, this is a different child at the school." They're asking me, "What is your son or your daughter taking now?" I mean, they're just it's a life-changing thing.
Great, Dr. Lawson. Thank you. I'm Scott Drake, and you're watching Sleep Better TV.